Hi, I'm Dr. Ken Lipstock. In this section of cataract surgery, we are going to talk about prostate medications and how they can negatively affect cataract surgery. If you already haven't listened to the Introduction to Cataract Surgery section, I highly recommend that you listen to those slides first prior to proceeding to this section. This section on cataract surgery refers to men, whether you already have a cataract or not. And it deals with the syndrome that we call BPH, or benign prostatic hypertrophy, which has to do with the fact that the prostate enlarges as you get older. And it's common once someone is over age 50, if you're male, because of BPH, to find that you have increased urinary frequency, and it can become annoying having to wake up in the middle of the night to use the bathroom. And so what has become very common is to use a class of medication called alpha antagonists, which relaxes smooth muscle, and it relaxes the smooth muscle around the ureter so that there is less frequent urination. The most popular and strongest one of this category is called Flomax. There are several other varieties, other brand names of alpha antagonists. And what alpha antagonists do is cause atrophy of the iris muscle, the colored part of the eye, inside the eye, and the opening in the iris muscle we know is the pupil. So it causes poor pupil dilation and something called floppy iris syndrome during cataract surgery. And this significantly increases the risk of cataract surgery. When you look at someone who's been on Flomax for a while, and remember, usually when you go on this, you stay on it. And so if you've been on this more than just a few months, the iris in many of these patients will start looking almost moth-eaten, very thin and atrophic. And when you enter the eye with the phacoemulsification device, the iris becomes billowy, and that's what I call the floppy iris. And the iris will tend to come right outside that 2.5 millimeter incision and get in the way of the phacoemulsification tip, and it really causes things to be more complicated, increasing the risk of the cataract surgery. The important thing to know is that discontinuing the medication prior to surgery does not reverse the problem. So the main thing is not to go on the medication. Urologists and primary care doctors invariably will not warn you about the floppy iris syndrome. A recent study was done that showed how few primary care doctors even know about the syndrome after the researchers who discovered this syndrome, which happens to be Dr. Chang, who interviewed me for that article about femto laser cataract surgery. Dr. Chang has written numerous articles and gotten them into the primary care peer-reviewed literature as well as the urology literature. But it appears, despite that, it hasn't made much of a dent. Few primary care doctors know about the syndrome, and even less act upon it. Similar, the urologists do somewhat better, but it is less than a third are actually telling patients about it, according to his study. But my experience, lots of experience for years in Richmond, as far as I know, nobody is told about the possible problem of floppy iris syndrome when they're put on alpha antagonists for BPH. Now, if Flomax or other prostate medications are needed, not just for convenience of not waking up in the middle of the night to pee, but medically necessary, in other words, you run the risk of severe urinary retention, then you know, if you need it, you need it. So then in that circumstance, what do? First, a skilled surgeon can work around it, although the risk is still increased. You could have cataract surgery prior to starting the medication. You can use another category of medication that does not cause floppy iris syndrome. One such brand name is Avodart. It's not an alpha antagonist, and it helps shrink the prostate. It doesn't relax the smooth muscle around the ureter. It actually shrinks the prostate. It takes a little longer to kick in, but can be very effective. Or you can use a non-selective alpha antagonist. The Flomax is the strongest because it's what they call a selective alpha antagonist, but there are other varieties such as uroxetrol, which isn't as powerful, and it still can cause floppy iris syndrome, but not as commonly and maybe not as severely. And then you can consider having laser surgery of the prostate for BPH instead of medical treatment.